So real quickly, this is our first webinar in a series of 5 that we're hosting, and it is around the intersection of income, poverty, and public health. And I want to thank our partners who've been involved with the development of this webinar series. And our partners are Wildfire, Vitalyst Health Foundation, Maricopa County Local Health Department, Coconino County Health Department, and the Arizona Department of Health Services. So thank you for all the participants in the development of this webinar. I'm going to go ahead and introduce myself, but also I wanted to make participants aware that we are recording this webinar today, and it will be posted on our ADHS website, but also Vitalyst Health Foundation's website in the next day or two. So I wanted to let everyone know that we're recording, and if you are not comfortable having it recorded, you can drop off the webinar now. So as an introduction, my name's Teresa Azrit Minigoats. I'm with the Arizona Department of Health Services, and I'm the office chief for our Office of Health Equity and Population Health. And I'm really excited today to bring together a number of speakers who will be talking to us about the local perspective and giving us insight into what is happening here in Arizona around income, poverty, and public health. Our learning objectives today there are 3 learning objectives today. The first is that we're hoping to provide a learning opportunity to individuals to learn about Arizona's efforts to support the intersection of income, poverty, and public health. We're hoping to provide an understanding on the importance of leveraging the work between poverty and public health partners. And the last objective is we're hoping that partners will learn ways to implement work that supports the intersection of income, poverty, and public health. A couple of housekeeping items. If you will please put yourselves on mute throughout the webinar, that will help with background noise. And then also, if you need bandwidth, please put your cameras on, your video cameras on mute also, or put your cameras offline. And this will increase bandwidth. We will be utilizing the chat function today. And so if you can utilize the chat function for any questions or comments throughout the presentation, we'd appreciate that. We will be recording this webinar. And to start our conversation, I'd like to do a quick presentation around how this initiative got started. We have a couple of partners that I want to highlight, but also talk about how we got to start to talk about implementing this webinar series. So if you'll bear with me, I'm going to stop sharing my screen and bring up a presentation. Sorry, I'm having difficulties. Okay, I can't bring up the presentation. Melanie, do you by any chance have the ability to tell me how to bring up a presentation again? I don't see that.
You should be able to, at the bottom, go to share screen unless your toolbar has been.
Okay. Yeah, I see it now. Sorry about that.
No worries.
Okay. All right. Sorry about that. Can everyone see my screen now? Okay. So I wanted to give a quick 5-minute overview of how we got to this point in hosting the webinar series. And I wanted to first set some context related to the work that we're doing. The work that we've ventured into as a partnership with Wildfire, Vitalyst Health Foundation, and Maricopa County and Coconino County Local Health Department is based on income. with regard to how it intersects with public health. So when we talk about income, we're talking about the definition here, which is income is money received, especially on a regular basis through work or through investments. And we're trying to identify income because wealth with regard to poverty is defined as another a definition. So really it's money that's received. And with regard to individuals most often earn income through salary or wages. And then businesses, they earn income from selling goods or services above their cost production. So those are the definitions we're using with regard to the work that we're venturing into. And this initiative started about 2 years ago, where the health department met with Wildfire, and we're having some discussions around economic stability and then also public health public health outcomes. And with regard to that, we know that economic stability and equality affects public health outcomes. And then vice versa, we know that public health outcomes affects income stability. So when we were looking at this concept, we looked at also the populations affected by income or economic stability, but also public health outcomes. And we saw that populations seeking services that are most likely to be served by our two agencies or entities were most often low socioeconomic insecure individuals. And so we started that conversation and how we as two entities could begin the work of intersecting between the two agencies, or the intersection between the two agencies. And we know that Wildfire works with the local community action agencies. And then at the health department level, we work with the local health departments at the county level. So really the initiative started there. And Wayne Tormala and Cynthia Zwick, who will be one of our speakers later, presented at our Healthy People, Healthy Communities IGA Summit about a year and a half ago. And so the conversation, we wanted to continue that conversation. And unfortunately, COVID hit and we were delayed in developing those conversations. So we're trying to come back to the conversation of how income, poverty, and public health intersect. A little bit about poverty in Arizona, and this is information from Wildfire back in 2019. We know that in Arizona, there are 14.9% of individuals in Arizona that live in poverty. And so that makes up a little over 1 million people here in Arizona. And we know that in Arizona, 20.4% of children are living in poverty, and that 33% of single parents are living in poverty, and that 9% of seniors are also living in poverty. And then this slide represents who's poor in Arizona based on race and ethnicity. And we can see that in Arizona, 35% of Native Americans or American Indians are living below the poverty line, followed by the Latinx population at 20%. So that kind of lays the groundwork with regard to the data and why our partnership began with regard to the initiative. And again, I want to thank our partners in this effort, Maricopa County, Coconino County, Wildfire, and Vitalyst Health Foundation. So at this time, I'm going to go ahead and turn the time over to our keynote speaker. And I want to go ahead and introduce Bonnie real quickly. Bonnie Bazada is from the Pima County Ending Poverty Now program. She's the Ending Poverty Now program is a 2015 initiative incorporated by the county's economic development plan. Bonnie works within the county's Workforce Development Department and collaborates with the Health Department, as well as other county departments and community organizations. She has extensive experience working with culturally and economically diverse communities on poverty and other issues in nonprofits, educational settings, and government. Bonnie holds a master's degree from the University of Arizona and a bachelor's degree from Anowich College, where she was a Watson Fellow focusing on the history and application of Gandhian nonviolence. Bonnie?
Good morning, everyone. It is such a pleasure to be with you. And thank you so much, Teresa and Melanie, for this opportunity, and Cynthia, and to my colleagues who are joining me this morning. Cynthia, Mary, and Ariane, very excited to be with all of you. And I know we have limited time, and there's always, I warned Teresa that I can actually talk all day about this. So I'm going to be disciplined and really try to stick with our time. And I have a lot that I want to share with you. So first I'm going to bring up my screen. And can everybody see that okay? Great. So first I want to just give you a little background on Ending Poverty Now. And then I want to give you some of the principles that we built our program, Mothers in Arizona Moving Ahead on. And then, because I think that will help you understand MAMA as a program framework. And then we're going to open it up for some questions. And then Ariane's going to share her personal experience as a graduate of the MAMA program. So here we are in Pima County, and we operate out of Tucson. And we're going to be talking about this program, MAMA, Mothers in Arizona Moving Ahead. And it was really designed for low-income moms in mind. And as you saw from that previous slide, a third of single parent households are in poverty. And we know oftentimes that's women. And so this was really targeting moms and their kids. We were so fortunate that, this really, we threw a lot of spaghetti on the walls. We were doing innovation, and so grateful to Vitalyst and to the Public Health National Center for Innovation, our funders, who got us off the ground, and were so gracious, not only in funding the project, but in guiding it and giving us input and holding us accountable. Dr. Garcia is our assistant county administrator, who has been so supportive of the program from the beginning. And so it had some unique components. And first, it was an interdepartmental collaboration, right? I'm in workforce development. So that's that financial health, right, that we're going to talk about today. But this was really sponsored under the health department. So we were able to kind of bring the best of our two departments together to look at those two sides of the same coin, right? How research is clear that when we start increasing people's income, we start increasing their health and their stability. But if people don't have good physical health, it's really hard for them to maintain work. So when we look at that individual cycle of poverty and poor health, it really, it gets in the way of so many things, including the ability to engage and complete education. So if we're not able to get through that education door, people get stuck in low-wage jobs, often difficult jobs, like now during the pandemic, those frontline jobs. And then they also get stuck into the benefit cycle, which has its own complications. And then we're going to look at how the stress of all of this continues to erode health and continue that poverty cycle. But if we look at it from an economic development point of view, which is really where my department looks at things, we see how that cycle really has a community cost, right? So the poor health shows up as people being challenged in the workforce. It's hard to take the jobs that are there. It's hard to keep jobs. I often say in poverty, it's harder to keep a job than get a job, right? Because all those things get in your way. So we lose all that human capital. And, there's a treasure chest of human capital for people experiencing poverty that we often don't get to tap into. And so that drives a lower economic output, and that keeps the cycle of poverty going at that level. I've done some work with Jim and Shirley Kaiser, and their estimate of the cost of poverty to Pima County is $2.3 billion a year. So there's a huge financial community cost to poverty as well as to the individual. So in Ending Poverty Now, we're saying, how do we shift our perspective, and rather than seeing people in poverty as a problem to be solved, that they are the resources to be tapped that can really benefit themselves and as well as the community. So when I do my work on Ending Poverty Now, I think about these things. How do we move beyond managing poverty, right? Because people in poverty often get really good at managing poverty. And then with the best of intentions, what we often do is just help them a little bit at managing it, right? A food box, some clothes, a class, but things that are not really breaking that cycle. And making sure that everyone understands that poverty is everybody's business. It affects the whole community. And then how do we build a better bridge so people can transition out? And most importantly, how do we engage people in poverty as experts and partners, which is what we did in MAMA? And how do we see the resiliency, strengths, and the protective factors that are in our individuals, families, and especially our communities? And I love this line: talent is equally distributed, opportunity is not. And that is our job, to open up those opportunities. So I think what matters in the big picture is generational poverty, right? The sooner and the longer you're in poverty, the harder a cycle it is to break. That children suffer poverty at higher rate than any other group, which is just a crime. We have racial disparity, and I'm so glad to see the racial equity conversation really getting lifted up and coming to the forefront, because without having that lens on, we're really not going to move the needle. And that we have areas of concentrated poverty and low opportunity areas that make it harder to get out. I know yesterday in one of Teresa's ASHIP presentation, it was shared that in Maricopa County and Phoenix, a 20-minute drive makes a 14-year difference in life expectancy. And that poverty accumulates in the body, and stress plays a major role. It erodes those opportunities for sustained work. And it also has this incredible emotional drain. We know in the pandemic that families who are experiencing poverty and are families of color are having many more deaths around the pandemic, more illness, and more economic impact. All of those take a tremendous emotional toll, and that gets into health. So we know that poverty is one of the greatest threats to children's health. I loved it in 2013 when the American Academy of Pediatrics named that. That was so important to shift out of just sort of a disease focus to seeing how this cluster of ingredients called poverty really makes an impact on kids' health. And we know that children are in families, right? And so their mothers are also experiencing the impacts of poverty and their health. But women are also the primary breadwinners, the most important teachers, the principal healthcare advocates of their families. So we have to find ways that we can really lift up and empower mothers in order to improve health for the family. So when I'm talking about poverty, I often say, it really, in this country, we are so economically segregated. It's like living on 3 different planets, right? The planet of poverty, middle class, and wealth. But we could get rid of those words, and really what it's about is, do you have enough resources to solve your problems? So we have one planet with too few resources, a planet with more resources, a planet with abundant resources. And really what that's about is stability. If you don't have enough resources to solve your problems, you're in a chronic state of instability, and that makes all the difference. So we all had to juggle a lot of things to get into this meeting today. But when you're experiencing poverty, you are juggling so many more things, many things that people don't see on the surface, and a lot of disparate little choppy things. How much money is left on my EBT card? How much gas is in my car? How much money is in my bank? How much toilet paper do we have at home? Do I have food to get through the weekend? When is the light bill due? Maybe you're taking care of an aging parent. You're trying to remember your bus schedules. All of these things that are in the background that are draining your brain power. So being in poverty and being under-resourced is really just like managing a full-time job in addition to whatever full-time job you may already have. So it's really important to, as we look at health issues that we keep two lenses on. The resource lens, which is the one we usually have on, we often have on, often because of our own economic experience, and also because our organizations expect us to plan into the future, to know how to keep our organization stable. But we also need that under-resourced lens. And we can achieve that when we have all economic classes at the table. And we have to acknowledge that our default lens for most of the way that we organize our work is for resource people. So I want to dig into that for just a minute. And I'm going to walk you through something that I usually spend an hour doing in a workshop. But I want to compare and contrast the experience of poverty with the experience of middle class and why that's important to this conversation. So here's the thing, in that circle are words that represent what people in poverty are probably spending their money, their time, and their attention on, right? So if we had time, we could unpack this, but you can take a look at that and would probably agree with me that those are the primary things. But if you take one thing in that circle, like transportation, and it breaks down, then it affects so many other things in that circle. You don't know what's going to happen next as a consequence of that transportation breakdown. So problems are interlocking. And because of that, it keeps people, it makes crises jumping up all the time. So it keeps people in a very short-term time horizon, right? You get stuck in the tyranny of the moment. It's an unstable and unpredictable circle. You don't know what's going to fall apart next. So there's a lot of problem solving happening, but it's very concrete. How do I keep the lights on? How do I keep gas in the car? How do I get to work, right? And the same problem you're trying to solve over and over and over again. And then in addition to that, you're outside of the norm and you're facing discrimination and judgment all the time. And so one of the classes I'm going to tell you about that we do in Mama is called Getting Ahead in a Just Getting By World. And we investigate the experience of economic class. It's a co-facilitated dialogue. And you generate up that very same image. This was a nice, clean image. This is what we do in the class. And you can see and you can feel from that image what life is like in poverty, right? What life is like when you don't have enough resources to solve all of your problems. And so the underlying thing for me that I see for poverty is the stress the chronic cycle of stress that it sets people in. And there's a cognitive tax, that's what researchers call it, a cognitive tax to poverty. It takes up your brain bandwidth, and that has physical and mental and behavioral consequences. So they talk about poverty being the equivalent of pulling an all-nighter over and over again. You get in that tyranny of the moment, and because your bandwidth is so loaded, like we experience on our Zoom calls sometimes, right? We get overloaded, and so you're not noticing things, you're not resisting things, you're forgetting things, you have less patience and energy. Contrast that with the experience of the middle class, right? So same thing, a circle where middle class people put a lot of time, attention, money into. A lot of the things are the same. So transportation shows up, housing shows up, but of course they look very different in the two circles. And the point here is that if your transportation breaks down in this circle, you have the resources to keep it from knocking everything else down. So you can anticipate, isolate, and solve problems. The point is to keep this circle stable and predictable. You're safety oriented, you have time for abstract thinking, and your time horizon can go way out, right? Months, years, decades, and you're normed. So that's sort of the basis of the work that the principles that we work from in Mama. And here's some interesting research to underscore this. They talk about uncertain pain outsizes the stress of certain pain. So if you can anticipate pain, then you're able to manage it better. But in poverty, there's so much uncertainty, and that creates its own sort of pain cycle, actually. And many of us are experiencing that in this pandemic, right? We're living in a similar experience of unpredictability and instability, and we're all feeling the stress of that. So we have these two very different worlds, right? I hope we would agree that there's a big contrast between these two worlds. And if and I didn't mention, so the driving force in poverty is relationships, right? You don't have the resources to bring in to solve it with money and other kinds of resources. So relationships become so important. So that means relationships have to be the cornerstone of the work we do when we're talking about health. So we looked in Mama about how can we shift from a more transactional approach, which we often use in both workforce and in health, right, to a more relational approach. And that while people in poverty need to be at the table helping us, the burden of change to change our systems, to change our policies, rests with us. And that means really understanding these dynamics that I just touched on. So just to give you now to move to the conversation on Mama and how we structured it, and you'll hear the resonance with these different principles. So very quickly, we kind of had an initial Mama, and then we did a Mama 2.0 under a REACH grant with the health department, which had different, some different dynamics and elements to it. I'm really going to focus on the initial Mama pilot. But you see there what our numbers were. I'm going to walk you through these different components. You can see, of course, that we have retention issues because of the longevity of the program, which we expected. The majority of women in our program were women of color. And we, of course, impacted a lot of kids through the program. And this was all partner-based. We really, wanted to work with and learn from partners in our community. So we had everybody from the food bank to a couple of residential drug treatment programs, to the Urban League. And we even had a men's group and a veterans group that we did an experiment with. So here's how Mama was structured. We started with this curriculum that I mentioned. It's a 50-hour curriculum, co-facilitated dialogue. The graduates of the programs can become facilitators. So we met once or twice a week for 17 sessions. And it's a very powerful curriculum, and it's focused on a future story, right? Because poverty robs people of a future story. So how do we do our investigations, build our resources, look at our own strengths, think about stability, and then think about new strategies for this future story. So people really get close to each other in this class. There's a lot of sharing. There's a lot of excitement. There's a lot of pain. And so we didn't want to just end it there. We take that whole circle from the Getting Ahead class and we move it into what we call the circles of care. And now we bring in allies who are professionals, who are volunteers, who are there to help moms continue to stay focused on their future story with a strong emphasis on what are your goals, how do we create the action steps, how do we overcome the barriers, and really helping and encouraging and analyzing and supporting together. We did that. We met for about 8 months for once a month. And then we had navigators throughout, right? So these are kind of like community health workers. They're there to be available to step in, intervene, solve problems, connect to resources in real time. And those are really critical roles. And we also had a systems design piece. We knew that we needed to drive this to systems change. So we call them health equity redesign workshops. And I'll share a bit more about that in just a second. So our objectives really looked at moms, allies, and systems. What were the impact? What were we able to change in those 3 areas? And we wanted to replicate the program. We also brought in a lot of house supplements. The moms would determine what they wanted in their own cohort. And then the health department was fabulous at coming in and bringing in speakers. We had at the end a health visioning workshop to really help moms stay focused on their health goals. And then we wanted to be adaptive and responsive. So as we found there was a need, we brought in more resources. So we found a lot of our moms had legal issues. It could be something small that didn't get attended to. So now it was a big, scary thing. And there were fees and fines, and people were afraid about going to jail or losing their vehicles, losing their jobs. And so we brought in the Public Defender Services Office and their lawyers, and we had a number of workshops that were really helpful to moms. We also did the digital storytelling, and 13 moms told their story, and you have a link to those. And we highlighted Ariane and Tasha's for you to take a look at. But they're really powerful. They're in the voice of the moms based on their experiences. So just a word about those health equity redesign workshops. We did one with Lead Local where we did 3 3-hour workshops. And we brought in health department reps, moms, and community partners, and came up with recommendations for how to improve access to healthcare. And I loved Nisa's comment there at the bottom. I really felt listened to by professionals for the first time. We did another one with the Center for Community Dialogue and Training, and we did 2 workshops and again presented it to healthcare professionals, and they came up with also a set of recommendations there. And I love this quote: "I felt like I was a somebody in the realm of somebodies." We experimented with things like, whoops, photo voice, I'm going the wrong way, sorry. Sorry. And as an analytical tool, and got some really great deep work from the moms, looking at things like show us how anxiety and stress feels to you, that kind of thing. And I think really underlying this was the idea that moms were in charge of their own program, their own goals, their own direction. We were there to support them and help them in that process. We did a closing event. So moms were like the docents and the presenters. We had about 100 people come. And we did a data party at the end where we shared their individual data and their collective data to get their feedback. And then we also supported and opened up doors for leadership opportunities in the community. Just a quick word on how we measured change. We had a number of things. We used a pre and post evaluation that used validated scales and other data, and we were able to show statistically significant change. I'll bring that up in a minute. There were 2 assessments in Getting Head that we used in 3 different spots that were very important. We did a goal attainment review. We had program surveys, and then of course we had the workshops and the digital storytelling. We developed a lot of new tools. We had an initial survey. We created this barrier tracking tool, tracking for the legal changes we were looking for. And interesting, when we compiled the barrier tracking tool, no surprise what shows up at the top, most that were barriers were around health and financial needs of women. But then you see legal necessities and self-care. So we were able to show that resource knowledge improved for the moms. That was really critical. How and where do you get resources when you need them? We were able to show statistically significant change in a decrease in perceived stress, an increase in social support, hope, and overall functioning, and a perceived sense of control. So I know those were not the normal things we might think about in health, right? But the feeling is that these are the underlying shifts that need to change in order to then drive other kinds of health outcomes. We had some great reflections from our participants. And then we've expanded MAMA. We've got a replication kit, and Maricopa is using it. A coalition of organizations in Pine started with it. Interfaith Community Services is starting with it, and Coaches is interested. Those first 3 were all interrupted by the pandemic, unfortunately, and as was our own reach efforts. And then we linked this now to a community health worker certificate program. We had 1 mom graduate from the first cohort who's now employed at the health department, and we have 8 graduates in the second cohort. They're halfway through right now. And I just want to share this last slide that came from the Hogg Institute in Texas, but in a little bit different context. But I thought these bullet points really sort of represented a lot of what we were attempting to do in MAMA, to really come at this health conversation from a different lens and see what kind of difference we could make. So I'm going to close. I know we've got a panel. We have opportunities for questions, and then we're going to hear from Ariane. So thank you so much. And that was really quick, I know, but I wanted to give you a little dense overview so we could move now to questions.
Thank you, Bonnie. Such inspiring work. I know there's always more that you would like to share, but we're going to go ahead and transition and bring in 2 of our colleagues, and we're going to have some discussion around the intersection of income poverty and public health with Bonnie. And so I'd like to introduce our 2 partners. The first is Mary Kincaid. Mary Kincaid is from Pima County Health Department, and Mary guides the accreditation efforts of 2 county level health departments and has worked with hundreds of agencies to develop prevention programs and interventions aimed at improving community health. And our second partner is Cynthia Zwick from Wildfire. Cynthia is the Executive Director of Wildfire, Igniting Community Action to End Poverty in Arizona, formerly the Arizona Community Action Association, and has been with the Wildfire since 2003. And so I'm going to start off with a couple of questions. And if Mary and Cynthia can please share a little bit about your organization and why your organization addresses income poverty and its effects on health and why it's important. So let's start off with Mary. Mary?
Good morning, everyone. Hi, I'm Mary. I work for the Pima County Health Department, and we work to improve the health and well-being of our community. Our work really focuses on preventing disease outbreaks and providing the public with information on how to make healthy decisions. We offer preventative care, and we enforce laws that keep consumers safe. We are also well positioned to mitigate the effects of poverty on health by continuously assessing and taking the time to really understand our community's unique challenges and their coping strategies, and also what resources are available and how we can connect people to those resources. We know that socioeconomic status is the most powerful predictor of disease, disorder, injury, and mortality, and that poverty is linked with substandard housing, homelessness, food insecurity, unsafe neighborhoods, and lack of access to healthcare, all of which adversely impact people's health. So poverty is at the forefront of every program, service, and intervention we provide and engage in.
Thank you, Mary. And we are so fortunate to have you here as a partner to the MAMA project. So thank you. Cynthia?
Hi, good morning. Cynthia Zwick with Wildfire. We are a statewide nonprofit that supports community action agencies as their state association. And we also have a focus on what our sort of definition is sort of stopping poverty before it starts. So really interrupting and disrupting the cycles of poverty that Bonnie demonstrated and talked a bit about. We work on a lot of social policy issues and really have developed relationships with not only the 11 designated community action agencies in the state, but we have a network of about 64 partners statewide with whom we work in order to really achieve our vision of an Arizona where everybody may thrive.
Great. Thank you, Cynthia. And we are so fortunate to have you as a partner also, and your links to the community action agencies. And I know we have partners on the webinar who may not partner with the local community action agencies. Cynthia, can you tell us can you offer some thoughts on how these partners can facilitate partnerships or collaboration, especially when funding is often so siloed between agencies, but also the way grants come down?
Sure, and thank you. I think, I think there's a couple of things to take into consideration, and I really want to sort of highlight one of the things that Bonnie mentioned, which is that we as a community, I think, have gotten very good at helping manage poverty. And so it's really important now that we look beyond that sort of functionality into a world where we actually interrupt, as I said, the system and really help families achieve opportunities and resources to thrive on an ongoing basis, to be resilient and have sustainable lives. And I think the way to do that is often in partnership with other organizations. And in this case, particularly with public health organizations, community action and public health should be working much more closely together. We're serving the same population. They're presenting with the same issues that affect, obviously, not only their economic well-being, but their health and mental health well-being. And I think sometimes we don't really understand or take the time to really consider if in partnership, we brought the resources to bear in a holistic way, in a collaborative way, we not only would, I think, benefit the community in which we're working and the individuals that we're serving, we'd also, I think, become much more efficient with the resources that we have. I think, you know, I heard Dr. Crow speak earlier this month about, he was giving a speech about the new economy for Arizona, and he was making a comment about our legislature and how to engage them. And his comment was, you know, we should stop settling for mediocrity and strive for modernization and innovation. And I think that's the opportunity we have as community action and as public health, is really to strive for modernization, strive for collaboration and partnerships, so that we really begin to help create bridges, as Bonnie indicated, for families to access.
Thank you, Cynthia. And I'm going to ask Mary this question because Cynthia kind of touched on the partnerships and the importance of starting to build those partnerships. Mary, can you share a little bit about how you see these agencies overcoming some of those barriers to partnership, and then maybe some advice on how to successfully work together?
Sure, I agree with Cynthia. The biggest barrier, in my opinion, to addressing poverty and really reshaping people's economic, social, and physical environments are breaking down silos. The responsibility for addressing poverty and social determinants of health fall on all of us, including many of our non-traditional health partners like Bonnie's department, housing, education, air quality, criminal justice, public transportation, and only together are we best positioned to create those policies, practices, and initiatives that improve the quality of life in low-income neighborhoods. Other barriers that are essential for us to address include examining and doing away with exclusionary policies, restrictive practices, moving away from expensive traffic violations for individuals without a valid license, or working with schools to remove zero tolerance disciplinary policies that lead to youth dropping out of school. And really removing those restrictions for justice-involved persons too, who are looking to find housing. So we can continue to move that needle forward and mitigate poverty's negative effect on population health if we step outside our comfort zone and really work with new partners to tackle these complex structural barriers that contribute to poverty.
Great. And Cynthia, are there additional small steps that folks can take to build partnerships and relationships between each other?
Yes, I mean, I don't think it's difficult, and I would venture to say that many of the relationships are in existence in some form. But I think there's a community action agency in every single county in this state. I know that there's also a public health organization in every county in the state. I think it starts with picking up the phone and having a conversation and really beginning to identify what some of those natural overlapping issues are, and where can we achieve some organization and coordination around those efforts. I think it's also looking to this group and asking for introductions in some respects. And I think it's also just looking at other resources that are available in the community and reaching out to begin a dialogue with some of them. Hopefully more people, the folks on this call and then folks that have not yet joined this call, will continue to participate and reach out to one another, even as we begin this process of interaction. I think sometimes I think we overcomplicate it. And I think really it's just about picking up the phone, especially the phone these days. But I think the opportunity is so significant right now because the hole that we're sort of finding ourselves in as a result of COVID creates many more opportunities, if you will, than I think we've experienced in a number of years. And so looking at, from a public health perspective, how we can work together to sustain folks economically as well, I think is really timely.
Yes, and you bring up a great statement with regard to COVID. And I'm going to pose this question to all the partners, to Bonnie, Cynthia, and Mary. I know we've had a great discussion related to the MAMA project. And the last question I have today is, we all recognize the challenges the pandemic has brought over the last year. And we know partners are getting fatigued with regard to COVID, addressing social injustices, trying to find partnerships so that we can utilize resources more effectively. But I wanted you to each share why you think public health and community action agencies, or partners in general, should use their bandwidth to forge new partnerships and deepen their existing work together. Maybe Bonnie, if you want to go ahead and start.
Yeah, this is, the pandemic really has handed us an opportunity, right? And has revealed things I think many of us knew were there before, but now it's in the spotlight. And so, for example, I'm working closely with our community action agency to look at eviction prevention, right? Because if we can keep people housed, then that's going to do a great deal to reduce the spread of the virus, but also the impact on people's physical and mental health is huge, right? So we're working with our health department too to look at how we can, for example, they have a care response team that connects people who are COVID-19 positive with community resources. How can we do the same thing for people who are facing evictions, right? Cynthia said it well. We're all touching the same person, but we don't look at how we can really kind of make it a one-stop shop, right? How can we wrap resources around people at the same time and really have that opportunity to be more efficient? I mean, it's more efficient for the customer, but it's also more efficient for our departments and for our community partners. So I think we just need to really look at how we can leverage our resources in some new ways, and especially to keep this equity lens. Like, it's clear that the pandemic hit people who are low income the hardest, who are already struggling, and we really need to keep our eye on that those are the families that we need to be more responsive to, and particularly our families of color and communities of color that have just been hit the hardest. So those things for me are in the forefront of my mind.
Thank you, Bonnie. Cynthia?
Yeah, I would probably build on what Bonnie is saying by suggesting that this crisis has not only created, I think, a stronger opportunity for community action agencies and public health to work together in not only immediate service delivery, but really looking down the road from a more holistic perspective and beginning a process of really seeing those customers that are coming through the doors or coming through the telephone or coming through a Zoom call now as a whole being, and looking at some of the work that Mama has done down in Tucson and taking into consideration the individual voices of the families that we're serving. I really think there are ways that we could be creative with service delivery, including perhaps even vaccination delivery. It's such a struggle now. And we continue to create these barriers to accessing resources, and that's not a criticism of any system. I know the pandemic has created just all sorts of problems, but what if somebody who's coming into a public health setting to get a vaccination could also have access to SNAP or get access to utility assistance, or, to Bonnie's point, access to the rental assistance programs that are popping up again all over the state with some new funding. So I think we need to begin as a community and as individual organizations really looking at a more holistic approach that takes many, many factors into consideration, and not just thinking that one intervention for a specific resource is the way to solve the problem.
Right. Thank you, Cynthia, for your insight. Mary?
Sure. I'll just drill down a little bit about exactly what Cynthia and Bonnie said, but really none of us have the combined mandate, the authority, the organizational capacity to really address the root causes that contribute to poverty. Just, we don't. And from tax inequity to lack of affordable healthcare and housing to the criminalization of the poor, accomplishing solutions to address poverty is going to require collaborative efforts across many sectors at all levels, including partners you may have never worked with before, like civic groups, faith-based organizations, banks, the Department of Commerce, really thinking big. And I hear all the time, especially from rural counties, that we don't have the funds, we don't have the staff. But you don't have to rely solely on grants or your agency's funding alone. There are many agencies, state and nationally, that have funds, they have the staff to support your cause. So again, like Cynthia said, just reach out. And I know we're all fatigued and exhausted, but even more reason why you should reach out to others for help. The more we can band together to share funding and resources, the more we can accomplish and the faster we can accomplish it.
Yeah, and Teresa, could I just add, I just really appreciate what Mary said, because I think the sense that we all have to do it ourselves has predominated often, and I think is fed to some extent by the fund sources that we individually administer. And I think that's one of the barriers we create for ourselves is, thinking that we have to do it ourselves. And I just really want to echo what Mary said about reaching out, using other resources in the community that are there for that purpose, and just sort of creating this wheel of opportunity rather than thinking we have to do it alone.
Great. Thank you. Thank you, Mary. I appreciate your thoughts. We're going to go ahead and transition now because we're at 10:50. But thank you to our presenters and our partners who've responded to a couple of questions. I will take a question or two if there are any, if anyone has anything from the chat. But if while you're thinking of questions or have a question in the chat box, I want to go ahead and transition over to our actually our guest, one of our guest speakers. We're really fortunate to have one of the MAMA graduates on the webinar today with us to share her experience with regard to going through the program. So I want to quickly introduce Ariana Deval. And Ariana Deval is a recent graduate from Pima Community College with a certificate in automated industrial technology, and is currently taking classes to obtain her associates in applied science. So Ariana, I want to go ahead and give you the time to talk with us about your experience in the MAMA project.
Okay, all right. Thank you so much, Teresa. So my name is Ariane. I'm super honored to be here. I started in the MAMA program in 2017, and then I graduated in the spring of 2018. It started in the fall of 2017. But my life has drastically changed since then. When I started the program, I was homeless. I had dual diagnosis, mental illness and substance abuse. And so I wanted to make my life better, and I just didn't know how. I guess social media isn't all bad, because I ended up finding the MAMA flyer on social media. And I was really excited about it. I remember thinking like this is gonna change my life. Like, I don't know if you've ever had those moments where a little voice in the back of your head's talking to you, but I just knew it was going to be powerful. And I remember telling my dad that I was going to start this poverty reduction program. And growing up middle class, my dad was like, well, what do you need a poverty reduction program for? Like, the only thing you need to get out of poverty is just to make more money. But it wasn't that simple, and at all, it wasn't that simple, especially for me, had quite a few barriers that were keeping me from advancing. My health was a major one, but I also, from a result of my untreated health, I had ended up acquiring a criminal background too. And so it was more than just getting a job. And so once I was able to realize that I needed to get a handle on my mental health, that let me to be able to get a handle on my substance abuse, which then, exposed other health problems that I didn't even know that I had. But, it was this snowball effect, a series of fortunate events. I was able to get my mental health under control, which then I was able to get my sobriety. I started volunteering out in the community, which led to a part-time job, which then led to a car. And then after I was able to get a little stable, I was able to go back and get my charges set aside. Then I started back in college, and then I moved to full-time. I ended up getting an apartment, and now I'm employed at Pima Community College. And so for somebody that was homeless 3 years ago with a substance abuse and raging mental health issue. You know, it's shocking to me, but you know, it's all just, you know, I would have never got there had I not taken the time to actually look at all the different factors that were contributing to me being in poverty and being able to tackle them one by one. And the things that I learned in Mama were able to help me. I mean, they actually have you sit down and they don't teach you. I mean, they don't tell you anything. They give you the tools and then they have you apply them to your life. And so being able to do that, it was more of a personalized plan that I was able to make for myself. And it was very empowering. But you know, I learned about health equity, you know, so I was able to just realize the benefit that I was able to bring to myself, you know, and so I'm proud of myself, but you know, I'm really proud of all the accomplishments I've been able to make, but I'm really proud of the difference it's made for my daughter. You know, she's got her mom back, she's got a stable life, she's got her own room. And so that's what means the most to me, you know, and so that's what I was really, you know, that was the whole point really, you know, but after, who started getting emotional. But it, you know, I'm very, very happy that I found the Mama program because it changed my life. And, you know, I never thought that I'd be involved in meetings like this. I never thought that I'd be employed for Pima Community College. And so, you know, I want to give back. I facilitated, you know, getting ahead programs, and I would love to be, get involved in the next Mama program that starts up, because somebody reached out their hand to me and helped me, and it made a huge difference. And I would love to be part of, you know, spreading that joy and hope for other people as well. So thank you.
Thank you, Ariana. Such an inspiring and empowering story. We appreciate you sharing that with us.
Thank you.
Thank you. Many claps for you and many thank yous and congratulations on your work that you've been doing through Mama. Thank you all for participating. This concludes our webinar. Thank you to our speakers and our partners who were able to share some of their thoughts and experiences regarding the work that we're embarking on related to poverty, income, and public health. If there are additional questions, I did not see any in the chat. So if there are, please feel free to reach out to me, and I'll try to facilitate. I want to thank our speakers. I want to thank Ariana, and I want to thank our partners in the Income, Poverty, and Public Health Partnership. Have a good day. Thank you.